With regard to the oncologist, does a patient's oncologist send you a referral to see one of your patients? Tell us how this works.
Well, oncologists in general do a very good job managing their patient's pain, but when they reach a patient that it's very difficult to manage and the condition becomes severely limited, then those patients get referred to my office for further advice and recommendation.
Can you go a little bit deeper into that when you say it's severely limited, that moment, or what happens with the oncologist when they simply have to make that decision that it's time to contact you?
Well, it's either because the medications used to control pain are not being effective, or the patient is having significant side effects like somnolence, severe constipation, inability to function. So those cases are referred to us for further recommendations.
Once the oncologist then sends the patient to you, how much collaboration goes on between you and that doctor?
Well, there's always constant communication. You know, we communicate back and forth. Usually we have a phone conversation between me and the oncologist, and then once I have a plan of care, it's communicated. They get copies of my reports, I get copies of the reports, so there's always constant communication.
Yeah, I would imagine you have to be talking constantly because as you're dealing with the pain management, it changes, the patient's pain changes, so you have to constantly be in contact, yes?
Most of the times we have constant communication. Sometimes it's not necessary. Once the pain is controlled, the patient will go back and follow up with their oncologist.